This exercise program is called the Throwers 10 program. It is designed to strengthen and improve endurance and prevent injuries in the overhead throwing athlete. The first exercise using resistance bands is internal rotation. That works the front of the shoulder. It is a very important movement for arm acceleration. It also helps as far as ball velocity. You would use resistance band, in this case a piece of TheraBand CLX, attach it to the wall, place a towel between your arm and your side, and rotate inward. The next exercise is external rotation. You would start with your hand in your stomach and you would externally rotate. This works the back of the shoulder, the external rotators, which is often injured. Now, coming up into the thrower's position, the 90-90 position, 90 degrees of abduction, 90 degrees of elbow flexion, the person is performing external rotation using TheraBand CLX once again. The movement should be as far as you can in external rotation with no pain. The arm now is up at 90 degrees of abduction and the person is doing internal rotation, working the front of the shoulder's internal rotators and accelerators, important in the acceleration phase of the throw and pitch. This exercise is called the full can. The person stands on top of the TheraBand CLX, hands placed through one of the loops, equal distance on both sides. They perform a thumb up type of movement going up to shoulder height. The person should come up to the shoulders, hold for a second or so, and then slowly lower. This is an important exercise to work your rotator cuff and also all the shoulder musculature. The next exercise is shoulder abduction. It's called lateral raises and works the deltoid muscle as well. Person stands on the TheraBand, palms facing the ground, and raises their arms to the side, stopping at shoulder height. The movement should be comfortable, should cause no pain, and should be able to do 10 repetitions. This exercise is called side-lying external rotation. The person is lying on the table on their side, holding one end of the TheraBand, towel roll placed between the arm and the side, and the person externally rotates. You should come up as far as you can that's comfortable without causing any shoulder pain. Next, standing with the TheraBand firmly attached to a wall or fixation post, the person horizontally abducts their arm or forms a T type of position. They should stop parallel with the body and not to allow their arms to go beyond their shoulder and body of the scapula. This works the rhomboids and middle trapezius muscles, which are important muscles to stabilize and move the scapula. This we call the Y. Person stands, TheraBand attached to the fixation location, and they come up overhead as if moving in a Y type of fashion. Again, they should come up as far as they can without any shoulder discomfort or pain. If pain is elicited, the exercise should be stopped, resistance lowered. If it persists, then they should see a healthcare professional. Next, the person is doing a standing row. TheraBand again is secured. Person's elbows are next to their side, elbows bent, and does a rowing or sawing type of motion, bringing their arms back. The movement should be comfortable. The movement should be easy, and you should feel a resistance or muscle activation in the back of the shoulder near the latissimus dorsi. This exercise is called a high row into external rotation. While standing, the person rows back using the rhomboids and middle trap, then externally rotates, going back as far as they can to cause a strengthening type of movement on the external rotators of the shoulder. This is a difficult exercise to do, but extremely beneficial for the overhead athlete. The next exercise is a high row. In this case, we're using a stability ball, so the person is seated on the ball to create a little bit more of a challenge at the core of the body. We like this exercise a lot for the rhomboids and middle trap, what I'm illustrating here. The instruction is for the athlete to pinch those shoulder blades together as they go back. Next is a high row into external rotation. The person is rowing up at 90, retracting, and then goes into external rotation, similar to throwing a ball. The muscle group that's being worked the most is the back of the shoulder external rotators. This is a tough exercise, but the benefits for strengthening outweigh the difficulty in the movement. The next exercise is what we call our lower trap exercise. Seated on the ball with good core stabilization, proper spine orientation, the person is instructed to externally rotate, pinch their shoulder blades together, and tilt back, thus activating the lower trapezius muscle group. The lower trap is a seldomly exercised muscle and is really important in the overhead athlete. Next, working our way from the scapula to the shoulder, now to the arm, the individual does bicep curls. While standing on the TheraBand, the individual flexes their elbow, activating the biceps. The biceps is an important muscle during the throwing motion because it helps in an eccentric fashion to decelerate the elbow. Next, standing on the TheraBand, raising the arm up above 90, the person now will do tricep extensions. With the arm supported with the opposite hand, the person simply flexes and extends their elbow, thus creating stress and muscle activation on the tricep muscle group. The next exercises will be for the wrist and forearm. While standing on the TheraBand, using the opposite hand, the person stabilizes the wrist and basically does a wrist extension type of movement. This is important for gripping a ball, strengthening the forearm to prevent any types of tendinitis. This is a good exercise to do prior to throwing. Next, turning your wrist over so your palm is facing toward the ceiling or sky, the person does a wrist flexion type of movement. This is important in the acceleration of the throwing action and also is very important to prevent any type of tendinitis, any type of soreness on the inside part of the elbow where the UCL ligament in Tommy John surgery is performed. Using a baseball bat with a weight being slid onto the bat or a donut can be used on the bat as well. The person supinates and pronates with a bent elbow. So the elbow is bent at 90 degrees, the arm is firmly fixed to the side of their body, and they just simply rotate, allowing their palm to go up and their palm to go down as they do the supination, pronation type of movement. Pronation is critical in the pitching motion. The last two movements to consider are stretches. This is called the sleeper stretch. And the sleeper stretch that we prefer is what we call a modified sleeper stretch. The person lies on their side and they do a quarter turn back. So they're not completely vertical, but rather rotated back a little bit toward their backside. And then using their other hand, they push into internal rotation. This is a great stretch for the back of the shoulder and can help prevent shoulder injuries. The last movement is what we call a cross body stretch. Person lays on their side to fix their scapula. Arm is up at 90 degrees. Using their other hand, they grab a hold of their elbow and they pull it across their body, getting a stretch on the back of the shoulder, the back of the capsule, and rotator cuff. This has been shown, again, effective to increase internal rotation and prevent shoulder injuries. By doing these exercises, your performance will be better, you'll throw longer, you'll throw harder, and you won't have any shoulder problems or elbow. Good luck.